Polygenic risk scores, polygenic index, polygenic scores, or PGS in short, they all describe the same things. But what actually is a PGS? A PGS is a score which predicts our genetic chance for complex traits. And complex traits are traits that are influenced by many factors, and one of these factors are our genetics. Complex traits, such as high blood pressure, are polygenic, or in other words, there are many genes that make it so you'll have a lower or higher blood pressure. Each of these genes have a small effect on the trait, and when you add them all together, you can predict a person's polygenic score for a certain trait. The effects are obtained from so-called genome-wide association studies that often involve millions of participants with information on one trait and DNA data. The researchers then go ahead and search for locations in the DNA that explain the variance in the trait of interest. Afterwards, the researchers will have a list of all these DNA locations with their individual effects, which they turn into a formula that can be used for the general population. Let's talk about some limitations for a moment. Misinterpreting polygenic scores would be dangerous, as scores only predict a predisposition and won't be exact for everyone. Furthermore, PGS should be used in the population they are obtained from due to ethnical genetic differences. And lastly, as has been mentioned before, we should keep in mind that complex traits are also influenced by other factors than just genetics. And now on to the last part. What can we do with PGS? Polygenic scores can be used to personalize healthcare. PGS can be used to predict an individual's risk for developing a certain disease, which then can be used to make a choice about who to screen and when to screen. We can also use PGS to predict an individual's reaction to treatments. This way we can choose the most effective treatments for each patient individually. And lastly, if based on your polygenic score you have a higher risk of developing a disease, and this disease is also affected by other lifestyle factors, physicians can preventively opt for a lifestyle change. Using polygenic scores, we can provide customized healthcare and keep our generation healthy for a long time to come. There is no one-size-fits-all anymore.
Created using Powtoon.